We are born with clear lenses that sit within our eyes. Just as I get more gray hair every year, both my lenses steadily become grayer as well. We call this lens a cataract once it is gray enough that we cannot see well out of it. This is a natural aging process, and if we live long enough, we all eventually get cataracts. Both lenses usually become cataracts around the same time. Cataracts cause your vision to be blurry. You may have difficulty driving, glare or halo around lights, decreased color and night vision, and/or a shifting in your prescription. Cataracts will not hurt you, but will cause your vision to get worse and worse. The only way to fix a cataract is cataract surgery. This is one of the most common and one of the safest surgeries in America. Most Americans are ready for cataract surgery by 70 years of age. The goal of cataract surgery is to improve your vision by 1. Removing the cloudy lens you are looking through, and 2. Replacing it with a new lens to decrease your glasses prescription. First, we use the latest technology to measure your eye prior to cataract surgery. I use these measurements to handpick the lens power tailored to help improve your vision the most. It is of the utmost importance that you have not worn contact lenses for at least 3 weeks prior to these measurements. Let us know if you have worn contact lenses within the past 3 weeks. Otherwise, your measurements will be incorrect and could result in suboptimal correction of your vision. There are 2 types of lenses we can implant: standard lenses and premium lenses. Standard lenses are covered by your insurance. The standard lens focuses you at one distance. You either get great distance vision without glasses, but then you need reading glasses for up close, or you can get great near vision without glasses, but do need a small prescription to see best far away. We have a unique opportunity in that we can change your prescription at the time of cataract surgery. Most patients choose to see well far away without glasses, and this minimizes the glasses power they would need to see good at distance. Although you will be happy with your distance vision, you will find you still need reading glasses for everything at arm's reach or closer. This includes the ability to shave and apply makeup. Even if you are currently nearsighted and you see well up close without glasses, you will lose this ability if we focus your vision at distance. This is a trade-off. Some nearsighted patients who naturally see better up close can choose to stay focused up close. This will keep everything in arm's reach sharp and focused without glasses, but you will still need glasses for the best distance vision. No matter what, the vision will be better after cataract surgery. Whether you want to see best far away or best up close is a personal preference. There is not a right or wrong answer. But do realize you will need glasses for either the best distance or near vision. Additionally, most patients have some degree of astigmatism, which is a bending in the cornea. Default cataract surgery will not correct astigmatism. For more information on astigmatism, please see our astigmatism video. Ultimately, most people do need a small prescription to get perfect vision, but the majority notice enough improvement that they can drive without glasses. Nonetheless, glasses can help you see up close or far away depending on your needs. The second type of lenses we can implant are premium lenses. These are not covered by insurance, but they can offer you good distance vision with some near vision, in addition to correcting your astigmatism. If you would like to learn more about premium lenses and getting more independence from your glasses, then please watch our premium lens and presbyopia video. As an example, this is how most of us would see when we were young. You may have needed a glasses prescription to get the best distance vision, but most of us could hold things up close and make out those finer details clearly. As we age, our lens slowly becomes cloudy and becomes a cataract. The change is so gradual and so slow that it's hard to notice, but eventually this is what a cataract does to your vision. It decreases the color saturation, the contrast, as well as the brightness, and it can blur the image. Now, what does our vision look like after cataract surgery? For most individuals, we'll notice that the color, saturation, brightness, and contrast are all improved. Most individuals aim to see well far away, so your distance vision without glasses would be good. However, these details up close will be a little blurry, and you would need reading glasses to make out these finer details. Alternatively, some individuals that are nearsighted can remain nearsighted. So, things up close will be nice and crisp without any glasses, but they will need a small distance prescription to improve the vision far away. Astigmatism will blur both your distance vision and your near vision. After cataract surgery, you will still notice an overall improvement. However, to get things the most sharp, you will need prescription glasses at both distance and up close. Most of us have a small degree of astigmatism. This would represent a larger degree of astigmatism. Finally, the premium lenses aim to recreate what you had in your 20s, giving you that good distance vision as well as some near vision without any glasses or correction. Once we are done planning, we can then proceed to surgery. Cataract surgery is performed in the hospital or surgical center, and you will need to be cleared by your primary care doctor beforehand. Make sure that you have nothing to eat the morning of surgery. I perform bloodless cataract surgery, so you can remain on your anticoagulation medicines. If you have diabetes, then please ask your primary care doctor how to handle your diabetic medications. Most patients cut their nightly insulin in half the night before surgery and don't take any insulin or oral hypoglycemic agents the morning of surgery, as they haven't eaten. You can take your other medicines with a small sip of water. This includes blood pressure medicines. Do not wear makeup on the morning of surgery. You will have an IV placed at the surgical center. We typically do surgery on one eye per day. We give you sedating medication through your IV and numbing drops on your eye. The anesthesia will have you in a deep twilight, similar to a colonoscopy. Most patients don't remember anything. Some remember seeing a kaleidoscope of light. Importantly, you will not be in pain and will not need to hold your eye open. During the surgery, I use one of the smallest incisions available on the market. This means that you will not need stitches after your cataract surgery. Now, a cataract is like an M&M. There's a clear candy coating and a chocolate center. This chocolate is what becomes cloudy. I use the latest surgical equipment to remove the cloudy chocolate material, and we leave that M&M hollow, and we leave that candy coating in place. I place the new acrylic lens within this clear candy coating, and your body heals around it. This new lens is so small that it's hard to see with the naked eye. Hundreds of millions of these lenses have been used worldwide. You cannot be allergic to them or reject them. Everyone is required to have a lens, otherwise your vision would be worse. Cataract surgery takes about 15 minutes. After you fully wake up, you will need someone to take you home. We always check you in the office 1 day and 1 week after surgery. As long as you are healing well, then we will plan to do your other eye roughly 1 to 2 weeks later. For several days after surgery, you will have mild foreign body sensation and scratchiness in the eye. Your vision may be blurry for a period of time after the surgery. Initially, it may even be more blurry than it was before your surgery. This is normal. It is also normal for the eye to have tearing and redness as well, and you may also notice floaters in your vision. The good news is that every day the vision will improve and the eye will feel better. Although cataract surgery is one of the safest surgeries in America, everything we do has a risk. The most dangerous part of your surgery day is when someone is driving you to and from the operating room. Statistically, being on the road is more dangerous than the cataract surgery and the anesthesia. Whenever we do surgery anywhere on the body, the knee, the abdomen, or the eye, there is always the risk of infection or scarring. Fortunately, these are all very uncommon in the eye. In the eye, you have roughly 1 in a 3,000 risk of a retinal tear and 1 in 5,000 risk of infection after uneventful cataract surgery. Sometimes after surgery, the eye pressure can fluctuate, or there can be swelling that happens in the back of the eye. These conditions are all treatable, and this is why we watch you closely after surgery. Once the cataract is removed, it can never grow back. However, some patients develop scar tissue behind their lens as they heal. If this occurs, it is very easily fixed in the office several months after the cataract surgery. Nonetheless, the majority of patients, over 95% or more, have uneventful surgery and are ultimately happy with their improved vision, color perception, and decreased prescription, and I expect you to be one of them. We are looking forward to helping you correct your vision.